Out of medical school in 1988, on to 1993, and Dr. HOURIYA KAZIM got her fellowship at the Royal College of Surgeons in Ireland, that's RCSI, and became the first female surgeon of United Arab Emirates descent, the first breast surgeon at that. Who Does What.tv caught up with Dr. HOURIYA while she was giving a talk at Bahrain's RCSI. Many advocate that, like an artist, surgeons are gifted and very special people. And when all is said and done, there are a lot of indigenous doctors in the region. But the Arab world is not exactly awash with female surgeons as such. So what prompted Dr. HOURIYA to make a mark?
Oh boy. Well, first of all, I come from a family of doctors. My father is a surgeon and my mom is a dressmaker. So it's kind of there. It's in my genes. And right now we have, I think, 70 doctors in the family. So I don't think it was a surprise that I went into medicine. I think I surprised myself by being a surgeon. I wanted to initially study infectious diseases, but it's, through medical school, many people change their minds as they get to find out more about the other specialties.
And her rather bizarre, but only to be expected story of progress in Islamic conservatism is well worth a good after-dinner speech or two.
Very much. I mean, people didn't talk about cancer, first of all, and they certainly didn't talk about the breast. And so, I had to start, and plus breast surgery as a specialty was a very new specialty or a subspecialty of general surgery. So in the beginning, general surgeons took care of everything. They set bones, they took care of your brain, and eventually all these specialties separated, and the last one was breast around the time that I was training. So I had to come back and, get people to, number one, say the word cancer, say the word breast, and know what I did for a living, and hire me.
As much as other countries might scramble to snap up talent and skills, another adage which more than a good few miss is that Arabs will always go home.
No, I always knew I was coming back to the UAE, because even before coming back as an intern, I mean, UAE is my home, my family are there. And then when I was working there as an intern in the government hospital, and I saw the kind of advanced breast cancer cases that I saw that really made me want to be a breast surgeon, I went back to the UK to do my postgraduate training and to the US, but I always knew I was going to come back home and do something about it.
The stigma must be still prevalent in local culture. Is it the risk or fear?
Well, I don't know if it's so much a fear or a risk. I think what I find with screening, if you're talking about screening women who are otherwise well, going to have mammograms, it's a evolutionary thing. When I was growing up, we never wore seatbelts in the car. Now we know that it's a good idea to wear a seatbelt. When I was growing up, even though I had educated parents, I didn't go to the dentist until I had a toothache. Now we know you go to the dentist every 6 months. You preempt things, you're more proactive. So the same thing, I feel it comes down now to getting women to take care of their health in general and their breasts in particular, in terms of getting them to get their mammograms done. And that's what I feel, that eventually it will filter down. It helps the internet and all the information out there help, because people now have access to so much information that tells them that they need to go and have screening mammograms. And as I said in my talk, I do get women now who come to me and say, I'm fine, I just want to be checked.
Of course, the Arab world structure is based around family business. So one supposes Dr. HOURIYA gets asked to operate on family members.
Yeah, and I get paid in handbags. Because I don't charge my family. So they send over a very nice handbag, by the way.
And to disconnect emotionally?
Emotionally is fine. I think, as all surgeons will tell you, at some point you have to disconnect. Not that this person is not human, but I have to go in there and know that I am the best person for that job, and I can't let emotions get in the way. And if I think emotions are going to get in the way, I don't operate on that person. And I have had sort of mothers or friends of mine that I've actually refused to operate on because they're too much like my auntie. And I just felt I couldn't, because if anything went wrong, I wouldn't be able to live with it. But I do operate on lots of cousins and aunts, and it's fine. I mean, you learn how to kind of just stand back, and this is my job, and that's what I think of when I'm there.
Bizarrely, now going viral, some American research suggests that mammograms kill more women than those that don't have them.
Yeah, it's a difficult one to answer. To be honest, the jury is out. That was the American Cancer Society, which is not a scientific organization, but they took some information from various places. The problem that we have really is not so much with that detail. The problem that we have is what we see, the disease that we see is different to the disease that you get in America. So in America, women are older. They don't have the kind of aggressive cancers that we have here. So when they talk about picking up cancers that maybe didn't need to be picked up or didn't need to be treated, we don't see a lot of those things here. What we see are very aggressive cancers or pre-cancers that definitely would go on to become a cancer. So it's really hard for us to take those kind of guidelines and bring it over here and try to utilize it here.
And the earlier mention of seatbelts, some suggest the wearing of which causes cancer.
I hope not. I didn't hear that one. But yeah, there's all kinds of things, underwire bras and underarm deodorant and whatever. I mean, you know, if they're telling you that they're not wearing seatbelts because of breast cancer, then, you know, we have some work to do.
Something will no doubt astound many viewing this. Dr. Houriya mentioned that different races have different cancers, and among the Arabs, it is more aggressive.
It's something called triple negative breast cancer. What that means is these breast cancers don't feed on hormones. And it's a very particular type of breast cancer. So we have many different types, actually. You know, we talk about breast cancer as one entity, but actually there are many different types of breast cancers. And this one in particular is one that we see preferentially in African Americans and also in our people here. So we suspect that there's something genetic going on, and most cancers are something wrong with your DNA, but there's something specifically perhaps wrong here that make them more likely to get this particular type of breast cancer. And that's why we need to do research here rather than taking things that people say in America and trying to bring it here. It's a different disease that we have here.
And the percentage?
In the U.A.E, we don't have a national cancer register, so I really don't have good figures.
Unmistakably passionate about the scourge of breast cancer, Dr. Houriya started an awareness body which goes well beyond that.
Yes, so we started Breast Friends, which is a charity for breast cancer patients and for breast cancer in general. Our mandate is threefold. It's education and awareness, it's treatment for breast cancer patients who can't afford their treatment, and it's research, locally based research on breast cancer in the region. As part of Breast Friends, we also run the only support group in Dubai by the same name, Breast Friends, which is for breast cancer patients and survivors.
What about male breast cancer?
Yeah, you know, they say in the books that it's 1% of breast cancers are men. I certainly don't see that many. I think, I don't know if it's because, you know, perhaps men self-select and go to a male surgeon rather than coming to me, the same way that most women prefer to come to a female surgeon. So I really don't see that many. I would say in the last 10 years, I've seen 2.
But Dr. Houriya does operate on men.
I do. Sometimes not for cancer, but sometimes men have other issues with their breasts, and I do operate on them.
A very active woman indeed, with a persona to match, not to mention very fit.
I love you.
And what about hobbies?
Oh, what is a hobby? What is a hobby?
No free time.
I have no free time. Not a second of free time. Not 1 second. So I'm at my desk before 7. Usually I have to go to the hospital and see patients before that, so I'm usually at the hospital at 6. I bring work home every single day. I've got my 2 kids, and you know, they're at an age where it's dropping for this, for soccer, for ballet, for guitar, whatever, you know. So I spend a lot of time doing that. I spend my Friday, I see my family, my immediate family, my parents, we have lunch together. And on Fridays, I just like to take off. So I take a walk on the beach. I want to stay home and drink tea in my living room. And for me, that is like fantastic. If I'm doing that, I know I'm having so-called free time. But I don't have a lot of spare time. And that, yeah, maybe I should have a regret about it. But I just feel, you know what, this time will pass. My kids are getting big. The time will come when I will have the time to do whatever. But right now, you know.
With little time to relax, does Dr. Houriya have any vocational regrets?
It's not really a regret. I think one of the things I would have loved to have been able to do was have more kids, maybe, which would have meant starting earlier. but the way life turned out and the difficulty of the program, and to be honest, you know, in the U.A.E, I was the first surgeon, but I wasn't the first who tried. There were others who tried, but they also tried to be the traditional wife and have kids, and it really is very difficult. So I guess something always has to give, but in my life, I mean, that's the one thing that I always think, yeah, it would have been nice to have more than 2 kids, but thank God, they're a blessing. The 2 that I had, even just to be able to have those in my 40s is a real blessing.
And what would it be if not a surgeon?
Oh, wow. I don't know. I don't know what I would have done, actually. I mean, there were times where I did think about leaving the profession. You know, you get days where you're just having a bad day and you think, God, I can't do this anymore. Nowadays, I think I'd be a florist. I just want to look at pretty things and that smell nice, and you know. Sometimes I think now if I left, I would go into teaching, or I think about management, but management's not me. I'm more like I like to teach. When I was younger, I used to think about law, and I used to think about going into medical, the medical legal aspect of it. But then I saw how many books I'd have to read again, and I thought, no.
As can be seen, Dr. Houriya is not your typical stereotype Arab. In fact, listening to her speaking, few would guess, and passing her in the street, most would have no idea at all.
That's like people say to me, you don't look like a surgeon. What does that mean? I don't know. I'll show you my ID card. I look very local in my ID card, wearing all my...
How often is Arabic used?
Oh, it depends. I mean, you know, it depends on the patients. In Dubai, we're very spoilt. I mean, most people can speak English in Dubai, but I mean, some local patients will only speak Arabic, or sometimes I have patients from Syria or Palestine or whatever who will only speak Arabic. But my husband's American, and my kids go to American schools. Their Arabic is actually better than my Arabic because they've studied it properly. But it's Dubai's different. You know, actually Bahrain is pretty similar. People speak, you know, whatever. And most people, you know, in Dubai speak several languages, not just Arabic and English. We all speak Urdu and we all speak Farsi, and we switch back and forth in the same sentence.
So having achieved such a lot, an immense respect and status, what's next?
If somebody else would pay for my kids to go to college, I'd go find an island somewhere with 10 or 12 people and just read trashy novels in a hammock. I imagine that. That's how I imagine heaven to be.
An inspiration to so many for sure. So what can those setting out on the same path expect?
Yeah, well, good luck. It's a tough road, and I'll be dishonest if I said it wasn't. I enjoyed a lot of it. I laugh about a lot of it now. At the time, perhaps it was not that funny. What I tell people is ignore the noise. There's a lot of people telling you what you should do and what you shouldn't do and what you can do and what you can't do, and you don't look like a surgeon and you don't behave like a surgeon. Whatever. If you have a passion for something, that's the thing that you follow, and you block everything else out, including, you know, aunties telling you to get married and have kids. Follow your dream.
And a steady hand. This is Geg Hopkins for WhoDoesWhat.tv with U.A.E breast surgeon Dr. Houriya Kazim.